Mic test. Mic test. Mic test. Good morning, everyone. Just to announce. All right, welcome back, everyone. We are approaching or starting our second day of the MILA, the Mariana Islands Legislature Association. Just to recap, yesterday we covered topics on transportation, labor, food security, and we received updates from the Marianas Regional Security. Moving on with today's agenda, we will be discussing topics on border security and healthcare. And with that, we thank everyone for being here this morning, and we will just jump right into our first presentation, which is, it will be made by our delegate from the CNMI, the Director of the CNMI Customs and Biosecurity under the Department of Finance. We have Director Jose Mafnas.
Hello, test, all right. Good morning, half a day, Tiro. Like I'm having a PTSD. Not the military kind, it's the law enforcement kind, PTSD. Anyways, I'm glad to be here, happy to be here. Thank you for inviting the CNMI Customs and Biosecurity to take part. Let me start from the beginning. I am not an expert on customs or border security. A lot of the mitigation or the modernization that we do back home is usually just, a lot of it is common sense approach. So that would be part of the presentation that I will be doing. With me is Colonel James Guerrero. That is going to chime in if there's anything that I forget, or during the Q&A, he can help, to answer. CNMI Customs and Biosecurity, we changed the name back in April 2021 when the Division of Quarantine was merged with Customs and placing quarantine under my care. So that's why we changed it to Division of Customs and Quarantine. We call it Biosecurity. One of our many responsibilities is to ensure that border security, ensure nothing dangerous goods coming into the CNMI. Like drugs, taxable high tax rates goods, especially cigarettes, the hot commodity to be smuggled in, liquors. We also collect revenue by collecting excise tax at the ports of entry. Every officer wears 3 hats as a tax officer, border customs officer, and also a quarantine officer. The CNMI ports of entry comprises of airport, seaport, and the U.S. post offices, both at the main facility and also the satellite post office in Saipan. And also the same treatment with Tinian and Rhoda. Our officers are posted on every port of entry. Our partners through MOU, we have the CNMI Department of Public Safety, US HSI, Special Agent, my good friend, John Duenas is here, the Drug Enforcement Administration, the Department of Correction, the United States Postal Inspector Service, Guam Customs and Quarantine, my good friend Hike Peredo, Director Peredo is here too, Public Health. We don't have MOU or MOA with the legislature, but we consider them as our partner. Representative John Posablon was a customs officer. He's still an honorary customs officer. But I want to thank you for supporting to our cause, especially through the enactment of legislation that we need. We are a member of the OCO since the early 90s. Annually we meet with the OCO. Every members in OCO, whenever we meet, we share the same the challenges are the same at the ports of entry, especially with customs and biosecurity. Everyone shares the same challenges, but I want to focus on two challenges that's always been mentioned, and that is the lack of political support and funding. I think this is a proper forum to share this. According to some of the OCO members, I think one of the they share is that more support is given to the police department, which is good. I support funding the police department. They have a critical role in protecting our community. But at the same token, similar support should be given to the customs and quarantine at the ports of entry. We are the gatekeepers. I'm sure you have the Navy SEALs and the Delta Force and the Special Forces here in Guam. We don't have that in Saipan, but they are not responsible to be at the ports to inspect containers and inspect passengers. That role lies with the customs and biosecurity, the same as us back home. We are responsible in protecting our borders to ensure that nothing of those dangerous goods, drugs, weapons, invasive species, prohibited agricultural products from entering the CNMI. In the CNMI, I don't know about Guam, in the CNMI, 99.9% of goods on the island are imported. The shirt that I'm wearing, the pants that I'm wearing are all imported. The food, everything in Saipan, from Mercedes-Benz to toothpicks, are imported into the CNMI. And that passes through, seaport, airport, or post office. Why is it better for us, the CNMI, to stop dangerous goods like drugs, weapons at the ports? Number one, it's cheaper. When you intercept this, like drugs at the ports, easier for us to do a controlled delivery to arrest the perpetrator. If it slips through, and I'm not saying that we are successful in every movement. At the ports. I know that there's some that would slip through the cracks, but one thing for sure, I would sleep good at night if I try my best to protect our borders. If anything slips through the crack, at least we tried our best. Okay. Just last week, we intercept about 1.1 pound at the cargo through the United Parcel Service, UPS. Made an arrest. That's what I'm saying. It's better to stop at the ports, but we can continue to do an ops to arrest the importer. There are FT fines imposed, and again, thank you, Legislature. Back then, we asked if they can it's a very short thing to, and I gave a copy to Guam. It's giving a legislation to impose fines on tax evaders, those that are trying to smuggle in cigarettes, those high tax rates goods to smuggle through the ports, 100% of the value of the goods. Okay, so say an importer would try to smuggle in undeclared, say, for example, 10 cartons of cigarette. The tax for that is $37.50 for the carton, but the fine would be the value of the carton of cigarette sold at the store. So if it's $50, you multiply that times 10, that's $500, and the fine stays with customs to use for training and other operational needs. The highest fines that we imposed against one of the businesses that tried to smuggle in cigarettes, about $80,000, and they paid. And I encourage them, don't pay. Let's go to court. You have to hire a lawyer. My lawyer is free, but you don't have to pay. But they paid anyways. So that law, though, forced now all this tax, try to smuggle this time, find cigarettes or liquor to think twice, because the fines is very high, and so in order for them, they just right now they're complying with all the laws and the regulations. One of the things recently, and it started last year, 2 years ago, that before we were finding crystal meth drugs in a container, say from China. The methods now have switched to the post office, and the freight carriers like DHL, FedEx, UPS. We mobilize. Once we started seeing that trend, we mobilized, created an 8 officers unit, just roving, going to the post office, assist the officers at the post office, do an inspection at the post office, do an inspection. We also have the satellite post office. We have private postal. That's one of the ways for the smugglers that are using the private post office. So, but those, when they are released by the post office, at the post office, our officers are at the back, they're 100% inspected. Again, if we find anything there, we just do a further investigation, do a control delivery. So, those are... Colonel, you want to add on?
What I'd like to add is that Customs and Biosecurity, in addition to reforms that are being made internally to be able to more efficiently conduct our operations, we've also at the same time developed a partnership with other law enforcement agencies. Just recently, Customs and Biosecurity actually organized a public safety agency leaders summit, brought everybody together from across the different public safety agencies. 16, 17 of them are law enforcement, and sat down together and are now in the process of developing projects of common interest where we could also share resources, more critically, intelligence moving forward. So that's just one particular initiative. We're also working on a number of different initiatives to kind of expand our capacity, or rather work towards furthering our capacity building efforts.
And I forgot to mention, like I said, in 2013 back, we have the same problems with Guam, and that is the infestation of drugs, crystal meth especially. So back then, 2013, we only had 40 officers. I got reassigned back, and wow, the officers were, stretched to the limit. You cannot, especially at the ports of entry, if they're understaffed or the officers are worked to the limit. I mean, you have a vulnerable border for the criminal enterprise to use. And so gradually, again, with the support of our administration and the legislature, we grew from 40 to now 110 officers. We have constant capacity building, again, and then more partnership with other law enforcement officers. I am very happy, to forge partnership with our federal counterparts and the local counterparts, including Guam, the Guam Customs. So I thank you, and that would the end of our presentation. If there's any questions, please feel free to ask. Thank you.
Thank you, Director Moffinas and Mr. Guerrero.
We'll now invite from the Guam Customs and Quarantine Agency, our Director, Ike Pereira, and Captain John Rick Mendiola, also from the Guam Customs and Quarantine Agency.
Hafan, good morning. First of all, thank you for the invitation to be here today to be a part of this forum. We look forward to making sure that we can provide some information with respect to border security here on our island. And I would like to thank the Mariana's Legislation Association. Welcome to Guam. I have with me Captain John Rick Mendiola from the Director's Office that will be supporting me in this effort. Next. Protecting our borders from illegal movement of weapons, drugs, and contraband, to include people, while promoting lawful trade and travel, is essential to homeland security, economic prosperity, and national sovereignty. Guam Customs is responsible for inspecting all passengers and cargo entering our island, stemming the flow of illegal drugs and other contraband, protecting our agriculture and economic interests from harmful pests and diseases, and protecting the island's businesses from theft of their intellectual property, regulating and facilitating international trade, assessment of use taxes, and enforcing both federal and local laws. There are 5 ports of entry in Guam. We have the Guam International Airport, the Port Authority of Guam, which also includes Upper Harbor, the Guam Main Postal Facility, Hagatna Marina, and Anderson Air Force Base. Next, please. Within our organization, we have 4 divisions: administrative support, inspection and control, which handles all the movement of passengers and cargoes that are coming into our borders. This is the backbone of the agency. This is where a majority of our staff are stationed, so that we can ensure that we have the proper staffing for each of our borders. We have logistical support, and of course, special enforcement, which handles all the follow-up investigations as it relates to border crimes. Next, please. The cornerstone of protection. In dealing with border security, we focus on 3 major factors. The first one is personnel. Second one is technology, and of course, infrastructure. Personnel being the most important part of our enforcement capabilities, because we need to ensure that we have adequate manpower to properly protect our borders. And of course, when we talk about technology, we need to start getting used with using technology to enhance our operation with respect to detecting and preventing the importation of contrabands at our borders. Next, please. Illicit drugs at our borders. If you look at this list, these are the types of drugs that are coming through and what our officers have been intercepting. Steroids, cocaine, fentanyl, heroin, ketamine, LSD, marijuana, methamphetamines, mushroom, PCP, oxycodone, Rofinol, Valium, Vicodin, and Xanax. Let me say that the most prevalent drug on Guam at this point in time is methamphetamines. And it is really impacting our island at this point in time because we see a lot of crimes that are related with drugs at this point in time. Next, please. We have our CQA methamphetamine interdiction graph here, and I managed to put together interception dating back from 2014 all the way up to 2024. As you can see from the first 6 years, from 2014 all the way to 2018, we have seen less interdiction of methamphetamine at our borders. And then starting 2019, we see an increase in the interception of methamphetamines that are passing through our borders. Just looking at the charts from 2019 to 2024, customs officers at the airport and throughout our borders have intercepted a total of 542 pounds of methamphetamines at our borders. 95% of these methamphetamines are coming in through the postal system. So this is where we are focusing our resources to ensure that we do something in not only deterring but preventing the importation of meth at our borders. Next slide, please. Interdiction programs. What we're doing to enhance our interdiction programs and our securities at the port of entries. Of course, as my counterpart mentioned, we do have cooperative agreements with other law enforcement agencies within the Marianas to include the federal agencies, law enforcement agencies here in Guam. We have also implemented a maritime contraband enforcement team down at the port just to ensure that they monitor the movement of goods and people within the Stero area at the Port Authority of Guam. We've graduated 39 officers in 2023 so that we can continue to increase our capacity out in the field in manning our borders and making sure that we provide sufficient manning of our port of entries. Recruitment, just this year, we're picking up an additional 20 officers, thanks to the administration, Governor Lulian Guerrero and Lieutenant Governor Justiner, to include the Guam Legislature, for providing us the support and funding for this additional 20 officers. We have 7 active drug detector K-9 teams that are manning our borders. We are also starting 4 additional training teams, whereas we're looking at importing 9 additional drug detector dogs within the next 3 months. Of the 9 that we're picking up, we are providing 2 to the Guam Police Department, and 2 of the K-9s will also be given to the Department of Correction. And then in 2025, by July of 2025, we have 9 additional drug detector dogs that we're planning on procuring, thanks to the assistance from the Attorney General, Doc Moreland, where he provided funding from the opiate settlements. Thank you, A.G. Moreland. We're also implementing the harmonized system here on island, and the harmonized system is the code that is used to import all goods coming into our island. It is the official nomenclature in identifying all commodities that are coming into our island. In addition to that, we will be sending officers to attend the commercial vessel search courses in Glencoe, Georgia, as provided by the Port Security Grant. And of course, lastly, we are also working with the U.S. Department of Agriculture to ensure that we receive all the training that we need to prevent the importation of plant and animal products into our island. Next slide, please. Improving the cornerstone of technology. What we've planned is that we are procuring an additional X-ray van that's going to be used down at the Port Authority to include partial van to conduct inspection on all parcels that are coming in. Handheld X-ray scanners are also in the process to include procuring additional X-ray baggage scanners for the airport. Most important thing that's coming up to our agency is the Customs Modernization and Automation Project. This is the project that's going to modernize customs on the way we do things at the port, in line with the implementation of the harmonized system, in which a law was passed just this year, Public Law 37-82, which is sponsored by Vice Speaker Tina Muñoz-Barnes and Senator Dwayne San Nicolas. Thank you for that particular legislation. That in itself will assist customs in modernizing our agency. Next slide, please. Moving on to improving the cornerstone of our infrastructure, we are at the planning stage of constructing a sterile inspection area down at the port. And this is to consolidate all inspections that are coming in, container inspections that are coming into our island. We have received funding to start the A&E process, and that is a vital step in moving forward with this project. We have also completed the completion of the Maritime Interdiction Task Force boathouse, which is in line with the enforcement and cooperation with the Port Authority of Guam, Port Police, and the NOAA federal agencies. Aside from that, we will also be procuring additional pole camp procurement for the marinas, such as the Aganyabot Basin and the Agate Marina. This all entails with having a platform under the customs modernization that will increase not only our processes, but will account for all the goods that are coming in to our island. Thank you. Any questions? I'll be able to answer your questions.
Jesus Masi, if you don't mind, we'll have questions right after the next presentation.
Okay.
Thank you. Director?
Thank you.
We'd like to also invite Special Agent John S.A. Duenas from the Homeland Security Investigations of the Department of Homeland Security.
Good morning. Thank you so much for this opportunity to present HSI. Speaking with some of the senators, there's been a lot of questions with respect to what is exactly and who is exactly is HSI. We've been an agency. I'm sorry.
Could you just make it a little louder? If you make it a little closer. Yeah. Yeah.
We've been an agency that's been here. We initially started as United States Customs Service, and then after 9/11, we morphed into Immigration and Customs Enforcement, and then ultimately Homeland Security Investigations. So if you could start the slide presentation, please. So this is our priorities, actually our authorization, our programs that we investigate. I'll leave that up there for a few seconds for you guys to absorb. The main programmatic areas that we see here in the Marianas is money laundering and narcotics smuggling. There are human trafficking cases, not as bad as what we think it is or you would think it is, but predominantly is money laundering and a lot of meth smuggling or narcotics smuggling. In addition to that, we're seeing an uptick in, we call it CSM, which is child sexual material, which is child exploitation or child pornography within the region. Next slide, please. So we have 30 special agent in charge offices. I'm out at the Honolulu office. And within those SAC, or within the nation, we have a total of 253 offices located strategically within the United States. Next slide, please. Internationally, we are located in 80 countries, and within those countries or within the international portfolio, we have a total of about 400 to 500 personnel throughout the world. Next slide, please. So about 3-4 years ago, when I got transferred back here to Guam 5 years ago, I did a strategic threat analysis of the smuggling of goods, the smuggling of firearms, the smuggling of narcotics. And I had looked back at what El Paso, what the other offices throughout the nations were doing, and I decided that I'd like to formulate a BEST, which is a Border Enforcement Security Task Force. Now, this Border Enforcement Security Task Force is comprised of state and local components, federal partners. We've gone out to the government agencies in the human trafficking arena. They're called the non-government agencies. These are the agencies that getting a lot of people. Yeah. Okay. Sorry, apologize. So these are the agencies. Is that much better, sir? Yeah. These are the non-government agencies are like your coalition, domestic violence coalition team. We work with these guys because what we realize is that the problem we have here in Guam is we're pretty much afraid of our own shadows, right? We know that meth is a problem, but yet we as a community, we don't go out and help our families or the people that we know that's involved in narcotics and turning them in to get help, right? We turn a blind eye, but yet we say we have a problem, right? So I took this all into factors and I created this Mariana's Best. One reason, I didn't want to call it a Guam Best. I didn't want to call it a CNMI Best. I wanted it a Mariana's Best because although we are connected by waters or apart by waters, we're all suffering the same problem, right? We all have the Met problems. I know I'm going to get hit up about the Chinese boats coming in, so I'm prepared for that. But essentially, we created the BEST, and with that BEST, we're providing state and local overtime reimbursement to the local agencies to include fuel for Guam or CNMI Customs for their boats. So every time they're out on an interdiction for HSI, we replace or we reimburse for the gas, for the fuel. So good program for our state and local partners. Next slide, please. So 97 BEST, out of the 97, we have one here in Guam, and then I was fortunate enough to oversee and create the one in Honolulu too. Next slide, please. And that's, you can't really see it. I had a tough time. The senator called last night asking for a PowerPoint, but just to put things into perspective, and basically this is the same programs that you saw on the previous slide, but just to put things into perspective, in one calendar year when I was in Honolulu, one calendar year, we intercepted $600,000 cash going from Guam to various states or various cities within the West Coast United States. All that 600,000, and that just came from one method of transportation, and I can't speak about it, but that was only one method of transportation. 600,000 cash, that was all illicit money. People that we seized the money, forfeited, people walked away from it and never claimed it. So just to give you an idea of how much dope is out there. Next slide, please. And I'll wait till everybody has questions. Thank you so much.
Situs Maasi, Special Agent, in charge, it says in charge for Guam. What is your jurisdiction of the CNMI?
So we have an office in the CNMI. It's staffed by three agents, one mission support, and I'm looking to put a computer forensics analyst up there. So we basically have the same authority as U.S. Customs, like what you would see in Honolulu or down in El Paso or down in San Isidro. The only authority we don't have, and we rely heavily on our partners, is the Customs Authority. So we rely on CNMI Customs and Guam Customs.
Situs Maasi, Is there a Honolulu, I guess, intelligence source, or I don't know, how do you work that?
So within our office, we have one Intel analyst, but we are supported by our Honolulu office, which has about 5 other Intel analysts. And then beyond that, we do have an Intel shop that we can always revert to for assistance if needed.
Your interdictions of cash, you also interdict drugs as well, the drugs, all the things that you listed. How do you do that? Where is that at? Is it at the border then itself, or where is it at? Yes?
Yes.
So you work together with the customs?
So that 600,000 that I alluded to earlier, that was strictly at the border. Okay, that was money that was leaving Guam, destined to cities within the western United States. We also have what we call the bulk cash smuggling initiative, and throughout the United States, we have highway interdictions where money going down south into Mexico is interdicted within the highways.
So just want to see if you don't mind holding for other questions. If I could ask the Guam Customs, just the Rhoda mayor said she's going to bring in, or trying to bring into Guam 2 marinas, or 2 docks to put at the marinas. If she does that, are we going to be able to service that more efficiently through custom, or, you know,
Sorry, but I didn't get the question.
So the Rhoda mayor yesterday gave us that she has 2 docks for the marina that she would like to place in Guam, strictly for products coming from Rhoda. And if she does that, would we be able to more efficiently service those boats coming from Rhoda, bringing goods to be inspected?
Oh, definitely. Yes, yes. That's one of the things that we're trying to do is increase the capacity to ensure that we have full coverage, not only for the from the areas at the port, but also the marinas.
All right. We'll take questions now. Questions, Senator Manglonia?
Yeah. Thank you, Madam Speaker. First, I want to extend our Dongkuluna Sidusumasi to the director. I know I was here a couple of years back asking for help about the operation down at the Aganya Boat Basin, and you were able to work out the situation and help tremendously our small boats operating out of the Aganya Boat Basin. I don't know if you remember, but Dongkuluna Sidusumasi to you for always being very cooperative and helpful and trying to address all the issues, especially between Rhoda and Guam as far as the shipping vessels are concerned. So, Sidusumasi.
Thank you for that.
I don't know how to address this issue, but I think the Vice President tried to mention a little bit about the pre-clearance from Rhoda to Guam. During the pandemic, it seems like the policy was changed, and they require now a CBP official down on Rhoda before our commuter flights depart Rhoda to Guam. Prior to that, they had just fax all the documents to Saipan CBP, and then that was sufficient enough. But now we have to fly daily, an officer from Saipan to Rhoda, and then fly them back again every day. And so, you know, I'm hearing that human trafficking is less of an issue now, and I think, you know, we're doing much better. So with the high cost of air transportation, I wish that there's a way that we can work out a situation here where these commuter flights maybe can go through CBP inspection here on Guam, or even just entrust again the airlines with clearance or something, right? I mean, at least to, and then only allow those with passport holders to board the flight. So, you know, as a result, our flights tremendously, the number of seats tremendously went down. Although a lot of these flights, I mean, some Marianas want to increase their flights. So I don't know if we can get an answer from the Homeland Security and Is there a way that Custom and Homeland Security can work together?
Well,
to...
based on what you're telling me is that there's a pre-clearance from CBP in Rhoda. Of course, we don't control the departures for Rhoda under CBP because that's controlled by the federal government. I think that's something that needs to be explored, but I cannot provide you that answer because we have no jurisdiction on that.
Yeah, and I'm bringing this up because I guess Mr. Earlier, forgot the gentleman from Homeland Security. Yeah. And I'm bringing it up also because I'm sure there can be a cooperation, right, between CNMI Custom, Guam Custom, and Homeland Security.
Yeah, so I apologize. You can't speak on behalf of another organization regarding the pre-clearance, sir.
Okay, so I'm going to maybe ask for more information so that maybe we can use this body to kind of, look at all the different issues that we can make possible this pre-clearance. And after all, I think this organization is here to try. I'm in full support of trying to have a one Mariana's concept here as far as custom, trade, immigration, and I think if we can have this, we can all rise up together economically, right? So
I think, sir, what we need to do is just try and set up some sort of communication, and hopefully that we can get in touch with you so we can sit down with the port security who handles the airport at CBP, and I think we can discuss what we can do to help you out on the matter. Thank you.
thank you.
Sijus Masi, Senator. Senator Burnett.
Sijus Masi, Madam Speaker, and again, thank you to this very informative panel. I guess I do have a few questions, and I don't know if Director Pareto would answer this, but according to the chart that you provided, the customs and quarantine methamphetamine interdiction graph, first of all, I want to congratulate your officers in your department for making record seizures of crystal methamphetamine. Sijus Masi. But what I think is troubling is as we've seen these record numbers of seizure amounts, the amount of crystal methamphetamine in our community hasn't decreased or lessened, and the price of crystal meth per gram is as cheap as it's ever been. And in talking to some of my CNMI legislative counterparts, they too are also struggling with crystal methamphetamine, but I don't believe it's at the levels that we're struggling with here. So, that being said, if our customs authorities are seizing these record amounts, mostly at the post office, where do you think the rest of this meth is coming in, and what can we do with your department to mitigate the entry of these dangerous drugs into our island?
Thank you for that question, Senator. So what we need in customs right now is to increase our capacity, and that's what I've been doing for the last 6 years that I've been director of this agency. We need to do more. We need to do more, especially down at the port. We need to increase the manpower down at the port to accommodate the workload that we have down at the port. I can tell you right now, although I have 135 officers right now, my number that I feel comfortable in protecting our island is at least 250 officers. And so that's the biggest concern that I have. We try our best, but we can do better with additional funding to increase our manpower down at the port, because I think that is where we need to also concentrate. I'm not saying that it's all coming in from the port, but that's an area that we need to improve and see what we can do to mitigate the problem.
Thank you for that answer, Director. And as you know, coming from the media, I've interviewed you multiple times about the issue of drugs coming into the port. And I just want to note for the record that here, so many years later, we're still having this conversation about having significant and increased customs presence at the port in order to mitigate the flow of the crystal meth and other dangerous drugs like fentanyl into our island. Madam Speaker, if you don't mind, I had a question for Mr. Duenas. And the question is, sir, thank you again for your presentation. And I guess my question is the border enforcement security team. I know that you deployed that in the Northern Marianas, and I have read in the media that it's also being stood up on Guam. So can you explain in what ways the border enforcement security task force will assist us in mitigating the importation of crystal methamphetamine, fentanyl, and other dangerous illicit drugs?
Oh, thank you for that question, sir. First and foremost, let me just help my partner, my local partners here, right? So I've made this known to many people is that it's nice to catch the illegal commodities here on Guam. It's nice to catch it when we do, right? But it's nicer to catch it if we catch it at the border, right? Prevention, getting it out on the streets is a lot better if we do it at the border. So, you know, my brothers and sisters at Guam Customs, they need help, right? They need manpower and they need resources. And I'll leave that to them because that's their kuleana, that's their job. But with respect to the BEST, what it does is it's a force multiplier. So we bring all these authorities together, right? NOAA, Fish and Wildlife, we bring the FBI, the DEA, the ATF, Guam Customs, Guam Airport, and we use all those authorities. So when we see a target or when we see that there's some illicit activity happening, we sit down, and if I don't have the authority to do it from an HSI standpoint, from the federal standpoint, then we use the local standpoint, right? Hey, let's go out and do a traffic stop. Let's go talk to these people, right? Let's use that authority. And the beauty of this BEST is that it's a Marianas BEST, so we take all that task force members and we travel to the CNMI and vice versa, and we're that plus up, we're that manpower, right? That's resource intense. Secondly is we provide that state and local overtime reimbursement, so money has to be paid out first by the government. The federal government comes back and reimburses, right? Then we also have the reimbursement for the field for CNMI Customs for their Marine Patrol. Every time they go out on an interdiction or an operation on behalf of the HSI, we pay for that field. We pay for the state and local overtime on that. Then the beauty, and which to me is a huge reason why the local law enforcement should participate in this, is that when we seize money from illicit activity, we give that money back to the government. So Guam Customs, we call it DAG, they request for that asset, Guam Police, CNMI Customs, or DPS. Thank you, sir.
Thank you, sir. And just lastly, in your the opening to your presentation, you had talked about how in the Marianas and specifically Guam, we admit that we have a problem with crystal methamphetamine, but we don't always see people who are willing to do something about it. And you had also mentioned that there are many on our island who know who the people who are dealing this substance. So just that kind of mindset and that interference, blockage, lack of willingness, how does that impede us in making significant changes on our island relative to just the crystal methamphetamine epidemic? And what would be your message to those people who don't want to assist or who feel scared about coming forward with information?
Right. So I'm going to get on my soapbox a little bit. Prior to my employment with HSI, I was a police officer in Guam for 12 years. Senator Frank Bloss used to be my supervisor at narcotics, right? I saw the epidemic. I saw it from start, and I see it till now. It's a real epidemic. It's an out-of-control epidemic that we have. Ladies and gentlemen, I'm going to tell you right now, in a couple years, if it's not going to happen now, which it is actually happening now, cops are being shot at. They're responding to a burglary in progress. They're doing hot pursuits. They're being chased and being shot at, right? We have a homicide. We have a homicide that the guy went and did a homicide, probably went and did a robbery after that, ditched the car, right? Felon in possession of weapons. It's only going to get worse. And the only way we're going to help is, one, we strengthen our border, number one. Number two is we come together as a community and help each other. Thank you.
Madam Speaker.
Senator Babauta.
Thank you, Madam Speaker. My question is to you, Special Agent Duenas. Thank you for joining us this morning. But you mentioned that you have a satellite office in the CNMI, Saipan in particular.
Yes, ma'am.
Are there any opportunities for CNMI to have its own office for a more efficient command and control I'm just concerned that some of the actions, and I don't know any potential actions that Homeland Security, HSI, may be in violation of or contradiction to our special agreement with the United States, our covenant. That may be a potential problem for our jurisdiction. So I'm just wondering if the CNMI can have its own DH or HSI office as a standalone rather than fall under the umbrella of Guam or Hawaii or any other jurisdiction.
So maybe I'm not understanding your question, but let me give it a shot. So we are what we call a resident agent in charge office out of Honolulu. And throughout the nation, because of the size and because of the population and because of the type of work, we will not identify that as a special agent in charge, as a standalone office. So we're going to piggyback on Honolulu. What I will tell you is that, you know, CNMI government is free to do whatever they want, right? But in my humble opinion, ma'am, my humble opinion, being born and raised and being an island boy, is that we should welcome all the help we can, because we can't do this alone, right? We can't.
I agree with your statement, sir, but would it be possible, we're looking for opportunities as well to have our own office like you do here, even though it falls under the umbrella of Hawaii, you mentioned jurisdiction under Hawaii, but the CNMI is, I think, has a greater challenge in that we have 14 islands under our jurisdiction, and that taxes, you know, your one office in Saipan. So we're looking for opportunities to, like you mentioned, assist also Guam office or Hawaii office by having our own standalone office, not necessarily as big as Hawaii maybe or Guam, but at least have our own, be able to have our own control of that office.
I think I'm tracking now. So the growth and autonomy of our office depends on the crime, right? It depends on the activity. So for me to say, absolutely, does the CNMI deserve a standalone HSI office? Absolutely. But, and maybe this is a good thing, right? It's not enough crime that's happening for me to justify a standalone office, right? Not to say that there's no crime happening, right? But the number of crime, right? So, I mean, it's just like a budget. Where your resources are needed, right? Where your people are needed, where your equipment are needed, you're going to move it there to address that issue. It's the same concept with HSI, ma'am.
Thank you, but my logic in that is there is an increase of human smuggling from the CNMI, particularly to Guam, and in a proactive approach, I think it would make sense to open up an office in the CNMI rather than have Guam personnel
Absolutely,
be stationed there.
Absolutely. I mean,
so I hope that
if there's a justification, I will do it. I mean, and you know, just to give you an idea of how much of a proponent I am. Number one is I'm trying to staff our Saipan office with local hires. Okay, I'm trying to get local CNMI people to apply for our job. And I want to staff it there because one thing, it's continuity, number one. Number two is they understand the culture, right? They know if you tell them go down over there to that road, they're going to go down and they're going to tell me where to go, right? As many times as I've traveled up to Saipan and as many times as I went down dirt roads, that the unimproved roads, just to get a familiarization, right? I'm still lost, right? But when I go down with like Jesse DeBrow or Jay Charlie from the DPS and they take me around, I'm like, wow, I didn't know this Texas road goes from here to there, right? So that's always my goal, is to hire local and to increase my footprint every time I add. So Guam went from a one-man office Today, I have 11 special agents, I have 1 criminal analyst, and I have 1 auditor and a mission support and 1 victim advocate. So that's my next goal is to increase our footprint in the CNMI.
And final question, Madam Speaker, if you don't mind. What is your relationship to our local CNMI Homeland Office? What is your relationship, if any, to our CNMI Homeland Security
So
Office?
every time I'm there, well, even if I'm not there, I try to stay in tune with Mr. Wabalta and also whoever's in charge of the fusion center up there, right? I try to include with the Guam Marianas Fusion Center. I try to in tune myself with those guys because they have the local information, they have the local intel. And, you know, I'm a firm believer that intel is not good intel if we don't share that intel, right? And that's what took down 9/11. That's why 9/11 happened, is because we were so afraid to share that intel.
Thank you. I yield, Madam Speaker.
Situs Masi. Senator San Nicolas?
Thank you, Madam Speaker. Sir, Officer Duenas, Special Agent, we work together, wonderful gentlemen. I wanted to address Senator Mangloñas. I think what you were alluding to, sir, was like interstate travel, interstate commerce. So maybe you could bring that up in the future discussion with the federal government, how you can just pre-clear or the minute you land in Saipan, it's domestic and also considering us domestic as well. So it's kind of like if I land in California, I could just drive to Utah, you know, without inspection. So that's that issue. And then the other one, sir, you know, I noticed that you said that you get funds and then you distribute it to the local law enforcement agencies. I also feel that's a really great thing, but I guess as legislators too, we need to also focus on education and prevention of these consumers. You know, there's certain type of characteristics of a type of person that would fall and be most likely to take up methamphetamines or to abuse drugs. So I guess as legislators, as leaders, we can also not only focus on interdiction, but also catch them at the onset when they're still children, and we can educate them in the school system. Because I think I was a Santa, or I heard this from one of our school counselors who was at the elementary level, and one of the students just flat out said he wanted to do what his parents were doing, selling drugs. And so, you know, it's disheartening to hear that from an elementary student. And I think it was one of a school counselors who shared that with me. So if we continue to not only do it at the border, but if we also enhance education programs to focus on preventing consumers of illicit drugs. What do you think about that, sir?
No, absolutely, absolutely. I mean, if there's any way that we could spread the word how detrimental, how dangerous drugs are, do it. I mean, you know, we cannot waste enough breath to get rid of this epidemic, right? I always tell the guys in our office, right? It doesn't matter if we encounter 1 gram of meth or we encounter 10 kilos of meth. That 1 gram of meth may be that poison meth that a 5-year-old is going to find in the merry-go-round, in the playground, ingest it, and die. And guess what? That might be my grandson. That might be my 5-year-old grandson, might be your 5-year-old grandson, right? Secondly is, that 1 gram of meth, for somebody to ingest that and then get into a car and plow into the parade that's coming up, right? So we don't know how bad the meth problem is or how much it affects us until it affects us. And when it does, it's too late.
Also, one more thing, I just wanted to, fentanyl's on the rise.
Sure.
How much of it are we seeing today here on the island and in our parts of the region? I mean, it's very disheartening to see it all over the mainland, and you know, it's just a matter of time now. So, I mean, is there an uptick trend on that?
Yes, there is an uptick, and I wanna thank this body. I think they're the ones who removed that restriction to have Narcan, right? Because when I was up in Hawaii and I started to hear about the epidemic in Hawaii, and I started to see, most specifically up in the Big Islands, where there was a lot of overdose from fentanyl and a lot of deaths. And when I started to see that, I said, you know what? I'm not going to say it's a matter of time. I'm just going to say it's happening in Guam already. And sure enough, it is happening, right?
And just how much fentanyl do you need to have an overdose?
Depending on the type of fentanyl, but it could be just that one little piece of rock. Or just the exposure to it. Yeah, you open up a package, you're exposed to it, right? People have different ways of reactions, yeah?
Thank you, sir. No further questions?
Thank you.
Caesar Swansea, Senator. Representative Yomo.
Thank you, Speaker. Just a question. Senator Selena did ask the staff members or investigators here in Guam. I didn't catch the number of investigators in the CNMI.
So I have, currently I have three investigators, and then we're staffed with like 3 task force, local task force guys.
Okay. With regards to worksite enforcement, the CNMI has an increase in undocumented workers, especially in the construction field. And so my office gets calls often about, hey, so-and-so is illegal, he doesn't have documents. So what is the protocol, I guess, because the community tends to call my office, maybe because I'm half Filipino, but they call me and they report on someone that has no documents. So my question is what is the protocol, and how do we, I guess, what is your role in the CNMI and our Department of Labor with regards to the I-9, I guess?
Yeah, so currently at the moment, I-9 audits or worksite enforcement is not really our priority at the moment. However, if there's a significance in that in the worksite, that let's say we're seeing an uptick in money that's flowing through that company, or if there's some illegal, in addition to the illegal hiring, right? Then we'll definitely look into it. But I will have somebody, I'll get your name, sir, and your number, and I will definitely have somebody from my office give you a call. Or your staff.
Yeah, thank you. And because we have our own Department of Labor, and Ms. Lila's not here, but she does enforce Ms. Lila's here. She has her work site, I guess, I forgot what it was called, but to identify, I guess, staffs, both local or U.S. resident and non-resident. But I get calls a lot, and is there a working collaboration between your office and her office to identify, because it hurts us, a lot of them are currently working right now in the construction field that are federally funded, and it might hurt our, the grants, and with all these construction companies hiring this kind of employees.
We'll get with you, sir. We'll have somebody from Saipan get with you.
Vice Speaker Muniban.
Madam Speaker, I had several questions, but the first one for me was to you, Special Agent Duenas, on best locations. And for me, best locations literally refers to the area that are strategically chosen for enforcement operations and investigations based on factors such as the criminal activity, right, and security threats and enforcement priorities. These locations are identified as high-risk areas where there may be an increase a need for border security measures and law enforcement. And it's up to the agents. They may prioritize these locations for patrol surveillance and interdiction activities in order to mitigate the risk and protect the countries in our area, right?
Yes, ma'am.
You said one best is one in Guam and one in Honolulu.
Yes, ma'am.
And as I was listening to you and you were thanking the reimbursement of what was done recently, I think was CNMI, I wanted to see what, because this is new to me, and if thinking outside the box, what can we do together to bring this best locations? If we're really wanting to stop it at the border and making sure that nothing comes in, what can best location do in this arena of making our oceans better served?
Well, thank you so much. And then again, I'm gonna refer to Guam Customs, right? I mean,
Yeah, please, Chief.
well, in terms of what can we do is we need to harden our border. And by hardening our borders, we need to give them the resources. We need to give them the manpower. We need to give them the tools to look at things, the tools to look at things in advance, right? To know what's coming into our island, to know what's coming into our commerce. That is the important thing, right? Is to know what's coming. Because by the time it gets into commerce, by the time it gets into the island, we are too late, right? We are too late. We're only catching a fraction of it. So harden up our borders, and then the Border Enforcement Security Task Force, we will address any threats that are within that border or at that border and within the borders. And if it's, the beauty of Homeland Security is we also have outbound authority. So anything going out of the United States is subject to inspection, which we could do. So we can get into a belly of an airplane and open up every luggage, every cargo that's heading out foreign. We're looking for more money, we're looking for firearms.
So the resources that come in for best locations, can we ascertain that through the federal government and other sources that are out there so that we can bring it into this region?
It's here, ma'am. We stood up this BEST program 3 years ago.
Right here on Guam.
And it's up and running today.
So then everything in the operations for the location is Guam is federally funded?
Yes, ma'am.
Okay. And in order for us to get that within the, like Senator Babauta said, within the 14 other areas inclusive of CNMI, Rota, Tinian, and Saipan, you talked about the numbers not being there. What is it going to take if we did a collaborated effort and include everybody in the Blue Continent within this specific region? Is that a possibility to look at? I see somebody shaking their head in the back.
So one of the things,
Saying
right?
yes. No, that.
One of the things that I'm keeping my eye on is the buildup in Tinian, right? So we look at threats, right? We do threat assessments, right? And where there's a buildup, we look at what are the threats with those buildups, right? So you have the influence, right? You got the China influence, you got the narcotics that are coming through. So it may be premature to say yes, we can stand up another BEST within the 14 islands, but I will stand here today and tell you there is justification to have another BEST, but it may be down the road within the next 5 years.
Okay. And Madam Speaker, if I may, and if I can have customs from both Saipan and Guam come up, I want to talk about the harmonized code and its integration. I know we're up for a break. The integration on the harmonized code, getting it fully implemented for this region, and what else do we need to do to make sure that this program is stood up? I'll start with Guam on the HS code. You talked about it at the end of the presentation.
Yes.
We finally have it passed into law, and now it's having to go through the triple A process. But in order for it to have its full implementation, what else may be needed for that? And is it in harmony with the Marianas?
Well, I'm not too sure that the Marianas are implementing the harmonized. Yes. So from a customs standpoint, although the legislation has been passed, the next step is to design and come up with the rules and regs, which we are given 18 months to prepare, and make sure that we have provided all the stakeholders the information that's needed to get this program moving. And that's what we're doing right now. We have a consultant that's here right now. He's been here for almost 2 weeks now. So we're planning all the training that we need to share with our stakeholders. And then from there, we can start mobilizing the information from the company that is providing us the software and the hardware for that platform. So that's where we're at.
So will that harmonized code fully implemented, would it be in concert with what's even happening in CNMI?
It should be, yes.
Yeah? Okay, thank you. I know we're up against time, but you can answer that, Chief.
And I know Guam is going to implement that ASICUDA program, right? The ASICUDA?
Well, that's the platform that we're looking at, yes.
Okay, yeah. Well, Cinema has been using HS code since we became members of the Oceania Customs Organization back in the early 90s. We feel that, data captured with HS is very important information in terms of imports and exports. So we've been using it, since early 90s, HS. And I think Guam also is in that process. And that would be nice, because we can be sharing information.
Thank you, Madam.
Mrs. Masi, I know we have additional questions, but we have to move on to the next panel. So we're going to just take a 2-minute break and come back for this next panel. And perhaps if these representatives who made presentations this morning can join us for the rest of the morning, we can ask our questions. Mrs. Masi.
It's getting an understanding of what programs are out there.
Can we take our seats, please? All right, welcome back, everyone. Up next, we have the topic of healthcare. And up first, we have the Chief Operations Officer from the Commonwealth Healthcare Corporation, Ms. Stephanie Crisostomo, as well as Chief Strategy Officer from the Commonwealth Healthcare Corporation, Ms. Eleanor Cabrera.
Hafideh Zantiro, Speaker Terlahi, Vice Speaker Barnes, Guam Legislature, of course our CNMI legislatures, senators, congressmen, councils, and all staff. My name is Eleanor Cabrera, and as Senator Manglonia mentioned, I am the Chief Strategy Officer at the CNMI Commonwealth Healthcare Corporation, otherwise known as CHCC. On behalf of our patients, our Board of Trustees, led by Chair Babalta, our CEO, Esther Muña, and all of our fellow employees across Saipan, Tinian, and Rhoda, and of course, beside me, our COO, Crisostomo. We'd like to thank you for inviting us to be here, offering a voice at the table about our CNMI health system, and to share matters of importance and concern relevant to us, as well as opportunities for CNMI Health, also relevant to the people of Guam. May we have the slide deck, please? At CHCC, our mission is clear. We work very hard and in many ways to provide quality, comprehensive health services and promote healthy environments for a resilient community. Next slide, please. Today, we'd like to focus on high-level, top-of-mind matters of successes regarding our healthcare integration and our improvements with access. Challenges, one of which is keeping this presentation to 5 minutes, but as we like to say in healthcare, we can't make any guarantees, but we'll try our very best. You can count on that. And of course, opportunities for us all with respect to Medicaid and the military buildup. I will yield to CEO Crisostomo right now to proceed with successes.
Thank you, Ms. Eleanor, and good morning, honorable members of the CNMI and Guam Legislature. It is an honor to be here today to speak with you guys to share our successes, challenges, and potential opportunities, not just for the CNMI, but for the region. So I'm going to go over some successes here on the next slide, please. Okay. For those who are not familiar, the CHCC is really a unique integrated health system. It's not just a hospital. We do have the only hospital in the CNMI, but we operate outpatient care clinics for family, women's, and children. We have specialty clinics such as dialysis. We have an oncology center, dental, and we're actually working on opening a cardiology clinic as well. We do oversee the public health department, and as you know, that encompasses many preventative health programs. Additionally, we oversee the behavioral health center and division, as well as the environmental health, disease, and prevention. Because the CHCC is an autonomous government agency, it allows us to have administrative offices as well. And that includes the Human Resources Department, procurement, grants management, to name a few. And it really does help in allowing emergency equipment supply and hiring. So it is really a unique system here. It allows for high-level communication, collaboration, and really maximizing resources. So we all know that public health and behavioral health does come with a lot of opportunity for grants. And so ensuring that we're aligning prevention to treatment in that regard is really what holds us together. Next slide, please. Okay, so moreover, the CHCC has been really busy for the past few years. Just in the last 2 years, a significant level of planning and development and investments post-COVID have been put into medical equipment, facility projects, and we continue to have some planning and pipe projects down the line. So just to start off with medical equipment with $5.2 million, one of them, which we procured recently, is a lithotripsy machine. So what that means is if we have a patient who has huge gallstones, instead of having to send them to Guam or Hawaii or California, we now have a machine that can actually non-invasively remove them. So what that means is that patient gets to stay on Saipan at home, and it also we also have that ability to keep our Medicaid dollars within the CNMI. Other projects here include facility projects at $18.4 million, in which we are currently still in I think, phase 2 or 3 of renovating our emergency department. We are slowly starting to renovate some of our inpatient rooms, just a portion of the rooms for now. We've expanded laboratories in Saipan, Rota, and Tinian, and as well as the specialty care clinics. Like I mentioned, we are working on opening a cardiology clinic. So all of these are really being done through federal dollars and donor partners. Without them, we don't have enough revenue to actually do these things. In the pipeline, solar power integration is really, it takes up the bulk of that $40 million, although it's not guaranteed that we have it yet. That's one of the major things that we're working on. One of our dream wishes too is have an outpatient clinic building across the street. We do plan on moving all the outpatient clinic and specialty care clinics across the street so that we can eventually expand the hospital, move the ER to the north side of the building, have more rooms to address any public health emergencies in the future. And that's really our forward way of thinking. So these type of enhancements have led the CHCC to working to improve patient care and environment, expand services, reduce costs to maximize efficiency, and really increase revenues by streamlining operations. Next slide, please. Okay. So with the Health Network program, formerly the Medical Referral Services, which used to be under the governor's office, is now with the CHCC. And we really do try to look into what patients are going out for. As you can see on this slide here, this is the most frequent referrals for Q1 of this year, which shows radiology being one of them. And what that is really MRIs. We send a lot of our patients just for MRIs. So thankfully, just recently, with the Helmsley Foundation, we announced last week that the CNMI will be able to obtain its very first MRI, which allows for more diagnostic care at a quicker pace. It allows us to really see what's going on with the patients, right? We don't have to wait for a week or 2 or 3 anymore. It's really just getting that MRI done and allowing the providers to let them know what the next step is. Secondly, with the shortage of providers, we are trying to work on allowing foreign providers to aid in the much-needed specialty care on island. So urology is one of our biggest needs as well. I know for Guam Urology, I think they recently closed. GRMC has one now, but we still find ourselves having to send them to either Hawaii or California. And we already know some that's willing to come down and just help us for free, although there's some constrictions here with the foreign licensing. So striving towards reductions is realized in number of referrals, and we are really trying to expand our services based on the need here. And not only that, right, expanding services also means keeping more of our Medicaid dollars within the CNMI as we're currently sending them out. And as we know, it costs 2 to 3 times more in Hawaii or California. So I'm now going to go ahead and pass it over to Ms. Eleanor. We do have some challenges, but we also have some opportunities that we want to address as well.
Next slide, please. So with respect to challenges, before I get into navigating the cost reimbursement structure that we have at CHCC and public funding shortfalls, it's important to show and get everybody on the same page with respect to what our base pictures are like with respect to our population. So according to the 2020 census, with our population of just over 47,000, with respect to health insurance, you can see that we have over a third with no health insurance and another additional third with public health insurance like as Medicare, but majority with Medicaid. It's important to note that because of COVID, the census enumeration was delayed that year, and Medicaid presumptive eligibility had already taken into effect. And of course, it's reasonable to suspect that the numbers are higher because Medicaid PE has in fact expired last year, May 2023. And so we're looking at really well over 2/3 of our population with either no health insurance or on Medicaid. And what that has presented to us is a situation of difficult and challenging cost reimbursement and the ability to deliver services within that financing structure. For fiscal year 2023, with respect to our revenues of $116 million, with respect to the CNMI appropriations of 5%, that's essentially when the CHCC assumed responsibility of the medical referral program, and transfers of a little over $5 million were provided to CHCC. We have grants and contributions amounting to close to 20%, and other services at 4%. And of focus really is 72% of net patient revenues. As you can see, the majority would be, as expected, Medicaid patients. So with the majority of our patients on Medicaid, and with our federal medical assistance percentage of 83%, what we're looking at is 83% or 83 cents for every dollar spent on Medicaid patients being reimbursed to CHCC. And as you can imagine, next slide please, some of the implications of that for the CNMI Medicaid. And looking at the bigger compounding picture, of our 83 cents to $1 cost reimbursement is CNMI Medicaid itself. All territories are federally capped with the Medicaid program. The CNMI has consistently been with the lowest federal cap, currently at $66 million, consistently through the years. I'm not sure if you're already aware, but in fiscal year 2023, the CNMI federal cap was exceeded for Medicaid in the CNMI. And that was largely due to Medicaid PE and CHCC's assumption of responsibility of the Health Network Program, formerly medical referral, and of course the proper and accurate billing of Medicaid services provided to Medicaid patients on medical referral, and of course our most recent outpatient service through the Oncology Center, and being able to provide oncology services to currently well over 500 individuals, over 300 of which are Medicaid patients. So what that essentially led in fiscal year 2023 was an $8.6 million shortfall of cost of services already rendered to Medicaid patients. And while CHCC continues to request for reconsideration by the Department of Health and Human Services and CMS has determined that the capped excess is a CNMI government debt to CHCC. And of course, other compounding pictures is the unfunded local match since 2012, whereas the federal medical assistance percentage is now 83% versus 17% with the CNMI for Medicaid and COFA, and 85% to 15% for the CHIP program. Next slide, please. We do have ongoing challenges, of course, as you can imagine, with the amount of people who are underinsured or uninsured with respect to uncompensated care. This averages annually $10 to $15 million. We have unfunded programs with respect to the Medicaid local match, which averages about $10 to $15 million in a year. Our health network program at $5 to $8 million, and of course, considering the many services currently and possible through public health services is an undetermined amount at this time. But I'd like to now take our attention to opportunities. Next slide, please. With Medicaid, it is clear that we have to continue to address parity with the states with respect to the federal cap removal. It is to our shared benefit as U.S. territories to keep pushing for the removal of the federal cap so that we as U.S. citizens are not subjected to these funding limitations not experienced by other U.S. citizens among the states. Having reliable and sustainable Medicaid funding is essential to building upon medical and public health systems for our populace to utilize within our own islands without having to seek expensive care elsewhere. We understand that this would take a congressional act, a change. And in the meantime, other matters have been presented to be considered in the interim. There's been discussions regarding a federal cap increase that's relevant to the population size and income base. We have also discussed the increase of the FMAP, which is the Federal Medical Assistance Percentage, but really this should not occur without a federal cap increase at the very least. Otherwise, we'd hit our ceiling even quicker. And last but not least, pointing to the attention of HR 8327, introduced by our U.S. delegate, Congressman Gregorio Khalili Sablan, which is ensuring Medicaid continuity for the Insular Areas Act of 2024. And this essentially would allow for the redistribution of territorial unused cap amounts. And this is important because we want other territories to know what had occurred for us in the CNMI for 2023. And the future is unknown. And trust us when we say you don't want to find yourself in our situation with respect to the shortfall and the economic difficulties within our territory. So it's within all territories' interest to consider supporting legislation in the interim such as this, because unused cap amounts for the territories and its redistribution could be have significant impact immediately for all territories. And so I'll turn it back to CEO Crisostomo to finish up our opportunities.
Okay, next slide, please. So really here to wrap up, one of the other opportunities is really is the U.S. military buildup on Tinian. I think it's something that we believe will help as well. The CNMI safety and security is a concern to the CHCC, and we want to allow our readiness and response team in regards to any public health emergency, threats of communicable diseases, drug epidemics, and so forth. So what we're really essentially asking here is for health to have a seat at the table to garner support for greater collaboration and coordination of services, such as expanding on pharmacy agreements for the VA and referral coordination, as we are finding that some of the VA members on Rhode Island, for example, are having a hard time getting approval from the VA if they need special mode transportation. So these are the kind of discussions that we stand by willing to discuss with, DOD if needed, but we truly believe that this will help. And so, next slide, please. Yeah, so with that said, on behalf of COS Sermunia, the Board of Trustees, our CHCC team, we truly thank you and appreciate your time. Thank you.
Thank you, Ms. Cabrera and Ms. Crisostomo.
We now invite, for Guam Memorial Hospital, Yuka Hechanova, the CFO, and Zaudi Tugadi, Association Administrator of Operations for the Guam Memorial Hospital Authority.
Good morning, esteemed leaders of the Mariana Islands Legislature Association. My name is Yuka Hechanova. I am the Chief Financial Officer at the Guam Memorial Hospital. With me is Zaldi Tugadi, the Associate Administrator of Operations. Our CEO, Lillian Posadas, could not be here today. She's attending the funeral of her brother-in-law, so we're representing the hospital, and she does send her regrets. Can we put up the slides, please? So the Guam Memorial Hospital Authority owns and operates the CMS-certified Guam Memorial Hospital and the skilled nursing facility. GMH is Guam's only public acute care hospital. We provide inpatient adult, skilled nursing, maternal child health, laboratory, radiology, pharmacy, hemodialysis, rehabilitative, and respiratory care. We also have outpatient services and our clinics in gastroenterology, pulmonary medicine, podiatry, cardiology, interventional radiology, and radiology. And we also have a very busy emergency room. Next slide, please. GMHA updated its strategic plan in 2023 following a challenging time responding to the COVID-19 pandemic. This exercise of putting the strategic plan together made us realize that GMHA's strength really lies in our dedication to providing compassionate quality healthcare and the dedicated staff that we have that are committed to work through difficulties and challenges. For example, GMHA was faced with very little data, very little experience, or specialized guidance to manage the COVID-19 patients. It was all very new to all of us. But in May 2021, GMHA won 2 prestigious awards, Hospital of the Year and COVID Management Initiative of the Year on Guam at the Healthcare Asia Awards 2021. These awards signify several achievements during the pandemic that include developing numerous COVID-19 protocols, establishing critical care telemedicine services, creating committees dedicated to clinical management of COVID-19 patients, and distributing various communication products to ensure continuous and thorough updates to all hospital departments, mainly to ensure the safety of our patients and our employees. Next slide, please. Our mission was also developed while we were doing the strategic goals. We updated it, and our new mission statement now is the Guam Memorial Hospital Authority is a public organization entrusted to improve the health and wellness of the people of Guam. We do this by providing an exceptional patient experience centered on quality-driven, safe, cost-effective healthcare services. We also establish new core values of community, compassion, innovation, resiliency, and trust. And our core values are the driving force behind our actions and attitudes and guide us to fulfill our mission. Next slide, please. So our financial challenges begin with limited cash flow. GMHA's current monthly cash requirements are about $15 to $16 million per month, and our total cash receipts a month average about $13 million, which includes our monthly allotment. So this leaves a shortfall of about $3 million every month. For the last couple of years, we have been working on improving our revenue cycle and have made great strides in strengthening our payer relations. We meet with them every month. We're really engaging with our payers now, and it's improved our collections with them. Staff training, and we've been able to do that with the grant we received from the Department of Interior. Charge capture and reporting and AR monitoring capabilities. However, we still face challenges with our reimbursements from Medicare and Medicaid, mainly because of low amounts that are reimbursed to us. We are known as a TEFRA hospital, and along with the CNMI and Virgin Islands, reimbursements are limited to Medicare allowable costs per patient stay in a designated base year. For Guam, that base year is 2014. So the gap between the 2023 Medicare allowed costs and the 2014 TEFRA limit was about $14 million. We also have a large self-pay population and slow turnaround to enroll in Medicaid. And we also care for patients that cannot be safely discharged with long stays, often exceeding 1 year, mainly because they just have no caregiver to safely discharge them. Therefore, GMHA continually relies on alternate funding sources, especially our annual appropriations from the Guam Legislature. Our next challenge is staffing shortages. We continue to have staffing shortages in nursing, especially, and allied health professionals. But now we're also having shortages in housekeeping, dietary, security, materials management, and even facilities management. Our third challenge is increased expenses for high labor and pharmaceutical and other medical supply costs. Persistent workforce shortages, fractures in the supply chain for drugs and supplies, and high inflation have caused many hospitals across the country to operate with little to no margin. Since the global pandemic in 2020, GMHA has experienced a tremendous increase in expenses that were thankfully offset by COVID federal grant assistance of approximately $25 million a year. And to help recruit and retain nurses, we implemented 2 pay increases in 2021 and 2024 per the Department of Administration's nurse pay plan. In addition, a pay increase for all other employees was implemented in 2023. The total annual impact of all these pay adjustments is about $23 million a year. Contractual costs are also higher due to the continued need for contract travel nurses and higher costs for physicians. Before the pandemic, we were averaging maybe around 10 travel nurses to augment our nursing staff. However, when the pandemic hit, we were recruiting up to 100 of them, and they were costing about $200 to $250 an hour at the time. But we were able to get reimbursed by FEMA for most of it, but not all of it. And because our patient census had remained so high, even after the pandemic had subsided, we had to keep the travel nurses. In addition, we were losing nurses. They were either going to the travel nurse companies or going off island to pursue careers in the mainland, or even going to GRMC, which is our other hospital here on Guam. Supplies and material costs are also increasing. We pay higher shipping rates, experience shipping delays, and many needed supplies like oxygen are available only from one local supplier. So whatever they charge us for oxygen, we have to pay it. Our next challenge, or next slide please, is our aging facility. So Zaldi is going to present on that.
Morning, everyone. I'm just going to be brief. And again, as expressed The big challenge is our aging facility. So, in response to that, we do have to maintain our environment of care and sustain operation 24/7, 365. We have challenges, of course, because it's aging. The building, the structure itself is okay, except that we have utilities that's way past its useful lives. So every now and then we are challenged with deficiencies, repairs, and you call it whatnot. For just May and June alone, we have about 450 work orders that we need to contend with, other than the projects that we have to work on to make sure that we maintain, again, the environment of care. We have to maintain the facility, as we all know, until we have a new hospital. So that's the very, very big challenge for every one of us. So again, ongoing facility assessment, that's where we're at, and that's the big challenge right there. And so forth, to address those, we have capital improvement projects. For the capital improvement projects, we have revived our maternal child health, family birthing center and renovation and expansion project. Roughly estimated at about 15 million. That's only the building. Of course, we have the FF&Es that we need to look at, about 5-7 million, furnishings, fixtures, and equipment. That is now in the process of review and recertification with our regional A&E designer, RIM Architects, and hopefully we'll be able to get their proposal for the cost of the recertification. Now, why do we need to have to recertify that? That project was done in 2019. It's already 2024. So there's a lot of things that happened. Pre-design, when it was completed, it didn't address much of the systems to address the COVID and other pandemic events. So those are the things that we need to consider now. Hopefully we'll be able to have all those addressed and get the plan recertified as soon as we can. 20 million ARPA project, funded projects, we have listed it into 4 categories. First is HVAC and other utility systems. Second is structural and architectural improvements. Medical equipment is the third, and the last is our IT network system infrastructure needs. As you very well know, we just had our system attacked or been compromised, so that's a big item also that we're working on. Again, just to talk more about our aging facility, we try to make sure that whatever system we have is maintained. So how aged are they? We got 3 generators to maintain our emergency power in case our local utility goes down. We have a 1992 1.6 meg. We got a 1998 1.6 meg also. And the newest, we call it the newest, is the 650 kW, which was installed and commissioned in 2004, 20 years ago. We have 2 boilers. Of course, we always have to do that to maintain redundancy in case one of the unit goes down. The oldest is 1989. The newer one is 1999. Chillers. Again, part of, these are all the systems that we need to maintain to make sure that we maintain the environment of care we need to cater to our needs as well as for the patients to be taken care of. The chillers, we have 2 450-ton, which was installed and commissioned in 2011. And the other one is 265-ton in 2009. We have all these systems. Medical vacuum, 2017. Hot water heater, 1995. Shredder, 2018. Autoclave, 2016. And we have above ground fuel storage tank, The oldest is 1999, the newest is 2007. Well, on the lighter side of it, we just completed one project, which is the liquid oxygen shelter. We improved from having two old 1,500-gallon LOX tank. Now we do have one 3,000-gallon and one 1,500 all new. But then looking forward to redundancy, we're looking at a mobile oxygen manufacturing equipment, again, as a redundancy, because we only have one producer here that supplies our LOX. A part of our plan also is to have our security and safety addressed. We have CCTVs and ACS projects coming along. We're in the verge of the procurement process for all these projects. So basically, we have completed in amount of about 400K. PO issued to be issued about 3 million. We only have drawdown 500,000. Active solicitation 8 million. Pending solicitation 8 million to total to 20 million for the ARPA fund. But again, there's also other funding that we have, DOI, to address other CIP projects. That's my presentation.
Mrs. Masi, Ms. Yuka, and Mr. Tugadi. Ms. Hechanova and Mr. Tugadi. For GMH, are there questions? So, Representative Probst.
Thank you. I think, is it okay if we have CHC join? You can stay there. I'm sure there's other questions that. Just wanted to comment that, as you can see, we all have equal issues when it comes to healthcare. It always seems the most challenging and the most underfunded aspect, and it is sad. I know that this is the 10th year I've been a public servant, and since 10 years ago we were talking about uncompensated health care and how it's been rising. What I've always been interested in is how does the hospital sustain itself with those staggering costs? About 10 years ago, it was in the same area, about 15 million. I remember talking about that. And with the challenges that we're facing now, of course, the cap with seats with the Medicaid, and if you're not on Medicaid, how do patients pay? It's self-pay often. You can correct me if I'm, but they're also, and again, please correct me on my. This is from my understanding. Often they're put on a sliding scale, and they pay over time. But from talking to people within CHC, it's such a long time that often they never pay back the amount, and this also becomes a loss. And further challenges have been when we have, of course, guest workers who leave, and trying to bill them, you're not going to be able to ever get that back. So again, a lot of this comes down to uncompensated care. So my basic question is, with these staggering challenges and everything, and when you have these millions of dollars in losses, how do you keep your doors open at CHC? That's my question.
Thank you for your question. We tend to internally say that what's happened in the past couple of years with U2 and COVID, it's been quite a blessing in disguise for us, right? Because as we know, majority of our patients are on Medicaid, and historically, the FMAP percentage for Medicaid was 55-45. So when U2 happened, there was a change in which the temporary FMAP was increased to 100%. And so that is how we've been sustaining. It's been 100%. It went down to a little over 89.6%, and then now finally at 83%. So yes, we do try to work with our self-pay patients, although we know that that's not going to essentially, really pull us through the rising costs of healthcare. It's really the Medicaid patients and addressing the Medicaid parity, which will allow us to expand not only services that we're not already providing, but more to that. We don't have a skilled nursing facility in the CNMI. We don't have an assisted living center. So like similar to GMH, we do have social admissions. We have an average of 7 to 8 patients that we can't safely discharge because they don't have any family. But to your question, it's really that blessing in disguise of the FMAP being increased and allowing us to get more funding from the federal share. Yeah. And then of course we have our private payers that pay, so thank you.
I'd like to add to that. Thank you, Floor Leader Probst. So we want to, while the majority, they aren't our Medicaid patients or uninsured patients aren't our only patients. So as Crisostomo had also mentioned, we do have about 20% of our patients on private insurance, and with a really firm commitment on our part to really stretch these dollars as best we can, I feel that the maximization of our integrated system has also helped us through with respect to the collaboration and the really optimal use of those integrated services to carry throughout. It is, you know, not a coincidence that we had the similar level of amount owed to our vendors with respect to the 8.6 million shortfall. But I believe with, you know, with the consistency of our leadership, the frequent communication and the pleas on our part to our vendors to continue to remember the people of the CNMI and the effort of our health system, not just being the public provider, but really the safety net, because it is expected and it is our obligation and our duty to serve all, regardless of an individual's ability to pay. And it's that by which drives us to continue to make the best use of the limited resources we have had.
Thank you. I yield.
Situus Masi, Representative Floor Leader Probst. Senator and Vice President Minglotna.
Thank you, Madam Speaker. Good morning to GMH and CCC. One of the biggest challenges that we have in the CNMI, and I think particularly Rhoda, is being able to retain medical professionals. A lot of them come for a 2-year contract and then leave, and then we have to spend so much money trying to recruit. And so one of the things that was brought up with Ms. Cabrera is the need for legislation to allow for foreign doctors to come in. And so that's something that I'm currently looking at and working on, and looking at other jurisdictions and how they allow for foreign medical graduates to practice within the CNMI or within their states and mirror that to the CNMI. So my question is to GMH. Is Guam allowed to license foreign medical providers or medical professionals? And if so, how has that worked for GMH?
We do have immigration limitations on Guam, so we are starting to think outside of hiring, especially for nursing, the travel nurses that I spoke about earlier. And we are exploring the solicitation right now to find out how we can hire foreign nurses, like from the Philippines and so forth, that are probably already green card holders or eligible to work here, so we can get those and directly hire them instead of paying a recruitment company to get them on board. But that's what we really just recently started exploring, that opportunity for the nurses.
What about for doctors?
For doctors, no, we have not. But we did have one doctor that was on a visa. He's not with us anymore, and we had to work. It took a really long time to get the visa for that physician. If the opportunity comes up for us to hire somebody similarly, I'm sure we would explore it, but we need to retain immigration counsel again. And if I'm not mistaken, it took over a year or possibly 2 years to get all of that initiated. In the meantime, what we do is we have also recruiting companies for physicians that we use. We use a company in the mainland, and they send us locums, and they stay with us for usually 2 weeks off, 2 weeks on, and then we pay them a fee for that. So that's the other alternative we've been using for physicians.
All right, thank you. That was all I had, Speaker.
Mrs. Masi. Vice Speaker Munya Barnes.
Jesus Masi, Madam Speaker, and thank you for the presenters here this morning. You know, I just want to share with CNMI that we just passed a measure to allow Guam to utilize the Center for Medicare and Medicaid Service Technology, and I want to thank my colleagues for their support in implementing a technology allowing for the approval of Medicaid and Medicare instantly. I would be more than happy to share the bill with the CNMI legislative colleagues, and I think this will make claims approval faster in improving access to health care so that patients no longer need to wait for approvals before seeing providers or availing specialty care. That was at the request of CMS, the Center for Medicare, Medicaid and Medicare Services, and I think it's something that we can look at, right? It's a joint contract thing with CMS, and at their request, we finally approved it, and it's waiting for the governor's approval. To the point that Tiffany brought up earlier from CHCC, I'm in an advisory committee for the Veterans Affairs looking at VA issues in our territories and Pacific region, and we just had our bi-weekly meeting this week with the CNMI Puerto Rico and American Samoa folks. Your commission members from the CNMI are our good colleague James Kennedy Benjamin and Ariel Bayum, I hope I'm saying that right, and I'd like to recommend that you raise this concern with them or give me a write-up, as we are mandated by the federal law to submit a list of issues veterans in the region face. And once we submit this, there will be a meeting here in December, and the Secretary of the VA is also required to implement our recommendations within 180 days or submit in writing a reason why he can't approve our issues of concerns. And I'd like to make sure that the concerns you raised up earlier as it relates to medical veterans appointments and care, that they be included. That's really, really serious. I had that meeting at 9 o'clock this morning with them, and we want to make sure that the issues that we brought up together, that gets included, because we did bring that up from Guam's perspective. Okay? So thank you, Madam Speaker.
Are there any other questions? Senator Babauta.
Just a comment, not a question, for CHCC. I don't know if you're aware, but another forum or platform for our Micronesian legislatures to bring up issues, federal issues, is APIL, Association of Pacific Island Legislatures. And last October in Chuk, the CNMI introduced a resolution to conduct a feasibility study for a regional health insurance modeled after TRICARE, in that wherever, with TRICARE, wherever a service member is stationed, they are covered, whether they're seen at a military treatment facility or an MTF or a civilian doctor. So this August is the next APIL General Assembly. I have reached out to Aetna International, the main insurance provider for the CNMI government, to conduct that feasibility study, and I'm awaiting word from them actually whether they have already conducted that feasibility study for a regional insurance within Micronesia. So that's another revenue stream for CHCC, and possibly Guam as well, including Palau, FSM, Marshall Islands. So I look forward to their feasibility study, and International was very receptive to that idea. That's why they were willing to take on the study. So I just wanted to toss that out to you and let everybody here know, both our colleagues from Guam and the CNMI, that we should be looking forward to some type of information coming out from Aetna International.
Mrs. Wasi, Senator. I wanted to thank you for your presentation and what you pointed out. There are, I agree with you, things that we share. For example, the parity, the federal cap removals for the Medicaid, and or otherwise, right, changes to FMAP or the federal caps. But I wanted to know if Guam, so there, we from the CNMI, there were data showing the most frequent referrals, and I was just wondering if, and then also that you are increasing specialties, right, certain specialties, and I'm wondering if Guam's hospital tracks this as well, kind of referrals from the CNMI, and which areas they are in, and which specialties particular, yeah.
Yes, so when the patients from the CNMI are registered in our system, all of those demographics are pulled, and we can run a report to see where the referrals are coming from and what specialty areas that they're referred to. If I'm not mistaken, I think we do get a lot of pediatric patients. So even like when the patients are transferring to like California or something, they often overnight at GMH because of the length of the trip. So they'll stay with us overnight.
Thank you. The referral, you said, CNMI said that they exceeded the federal cap, and one of the items listed under that was a medical referral was transferred to the CHCC. Can you just explain that more? How did that impact you? It was handled by another office or another entity? And so the costs for medical referral are being incurred by CHCC now?
Yes, so medical referral services used to be administered by the governor's office for the CNMI. In 2022, it was transferred over to CHCC. And so there's supposed to be appropriation to it. It used to run at least, I think it was $15 to $19 million a year, that program alone. But since we've taken over, I think we've managed to look at what we don't need, right? So it's now it's budgeted at 5 to 8. I think for this coming fiscal year, we are budgeting about $6 million for the program. We actually, when it was under the governor's office, one of the items that we took out was blocked rooms. We noticed that blocked unused rooms, right? We were looking at utilization of how many patients are going to these different locations, and found that, you know, we didn't need X amount of number of rooms per location, essentially saving about $20,000 to $30,000 a month per location in Guam, for example, in Hawaii, and in LA. So that's one of the reasons of the reduced costs. But yes.
Thank you. I also know that we share this pharmacy and the VA pharmacy, right? That was one of the issues that we thought could be achieved, hopefully, working together, that can be achieved, that you're doing the long-distance pharmacy, like they're doing here, the VA is requiring them to do for patients here on Guam.
So what we're finding is that for VA patients who are discharged, right, it's not easy for them to get their medication. They're required to see a VA provider first to confirm that those medications they were discharged with is appropriate. Once approved, they go to the VA the contracted pharmacy on island, get a temporary limited amount, and then they get mail order. But what we're trying to do is say, hey, what can we do to make it easier for them? You know, what do they have to go? They shouldn't have to go through those hurdles. So that's what we mean there.
Yes, thank you. I think we share that same issue as well as the referral coordination for the VA, right? Some of the gaps. So, Sizus Masi again for your presentations, GMH and CHCC. And congratulations on getting your new MRI. That sounds like a game changer, a very big news. Any other questions? If not, Sidus Masi. All right, we're going to break now for a while. When we come back, we're going to have a very short, at 1:30, presentation by Guam Power Authority in relative to the solar farm tour on Saturday. So if you're interested in the solar farm tour, we'd just like to get a head count, if you could just let our staff know in the front. And it's not going to be too long, it will just be a couple hours. And we have transportation leaving from here to there tomorrow. Otherwise, we'll meet you in a little while. Sidus Masi.